Welcome. This is our second second webinar that we're hosting in Inspiration and Insight series. This is for MACP only. But if you're not an MACP and you're joining us, it is open, so welcome. Please use the chat box if you have questions or comments, and we'll try to stay on top of that as much as possible. We're having a little bit of access issue, it looks like, because one of our presenters is having a hard time getting in. And Alyssa, if you could.
I'm telling him how to do it.
Okay, great, perfect. That works. Yes, they are recorded, and so we will be posting this if you want to go over it, or if you want to share it with others in the MACP program, you're welcome to. So we're going to be talking today about using metaphors in mental health counseling, and really we want to kind of focus it a little bit on two different things. And the first is that we want to focus in on using metaphors in general if you're going to be doing therapy. And then the second piece is a lot of you are eventually going to be supervisors. And so because of that, we want to make sure that you know how you can share it with your peers, you can share it with your client, and you can share it with supervisees in the future. So there's a lot of different ways that we're going to be using that. Okay, so introductions. Dr. Weiss.
Hi, I'm Dr. Weiss, and I have a doctorate in marriage and family therapy, and I reside in Florida with a private practice. I work with individuals, families, and couples. A lot of my work is a lot around couples and families. I come from a systemic approach, so I feel that the system plays a role in how we relate to others, and I also use a strength-based model, either solution focus or narrative. And with those two approaches, metaphors are very pertinent in my practice. Either somehow my clients say things and I help develop the metaphor, or many of my clients have come up with their own metaphors. I'm also certified in traumatology, and I do hypnosis, and I am certified in New Zealand therapy, which is what we do with individuals with autism. It's a room that was set up that I helped develop in the University of Miami that does all these different tactile things, either visual or hands-on or hearing. So depending where the child lies on the spectrum. Mm-hmm. And I'm a full-time professor at Yorkville.
Yes, representing. Oh, it looks like Dr. Brown just joined us. That might be really great timing. Dr. Brown, are you with us? Doing like a little test here, test.
He is saying that it's the circle of death. I think his computer is spinning.
Oh no, okay. I saw him in here and I promoted him to a panelist, but I don't, okay. All right, so hey guys, I guess I'm next on the list. This is good for Dr. Brown.
We're buying him some time.
It's like perfect timing, right? Hey there, I'm Dr. Sarah Stewart-Spencer. I'm actually your Associate Dean of MACP, and I also teach, so several of you I've had the pleasure of working with. I'm licensed as a counselor in 2 different states in the U.S., Virginia and Florida, and I'm also a nationally certified counselor, and I'm certified as a hypnotherapist as well, and a clinical trauma professional. I do a lot of different things, actually. So I teach here in the States. I teach at Yorkville. I work with the International Trauma Training Institute, working with bilateral stimulation that's combined with hypnotherapy and training clinicians. And that's where a lot of my focus has been. And I've had the pleasure of serving as the editor for the Therapeutic Speakeasy Quarterly, which is an independent journal, and writing about metaphors in therapy. And so that's actually a piece of what we'll be going over today. So super excited to talk about that. And Dr. Brown, perfect timing.
That was wonderful. There's nothing like technological glitches when you're going into a presentation.
Right.
Get your heart going. So, Dr. Andy Brown, and much like my colleagues, I am involved in a lot of different things. I'm a full-time professor of clinical mental health counseling down in the States. I also work as an adjunct here at Yorkville University, and I'm program lead for the Crisis and Trauma program. I work for the International Trauma Training Institute as the Vice President of Education. I also recently obtained my Master Traumatology certification. And I enjoy trauma. I also, much like a lot of people, I do varied things in my practice, enjoy phobias and philias and these kinds of things. And I enjoy speaking with these two individuals that I'm really fortunate to call colleagues and friends.
Awesome. All right. So we're the team that's going to be kind of talking and working through your questions in the chat box. And Alyssa and Andy, while I have this up, it won't let me pull up the chat box. So if you guys see anything pop up, let me know. So we're going to be talking about metaphors. And like I said earlier, you know, when we say using metaphors, we mean using it with clients, using it with peers, peer-to-peer discussion. But in the future, after you get out of this program and you practice, becoming a supervisor and using it with the staff that you supervise. So there's a lot of different ways that you can use it. And the reality is metaphors have been passed down for centuries. This is nothing new, right? We even see a lot of metaphors. If you think biblical times, they use a parable to pass down some kind of really important lesson, to make sure that everyone kind of understood the meaning. So there's a beautiful piece about metaphors, is that they've always been with us. This is not something new in a sense. So this has been passed down for centuries. So we want to use it because it's actually essentially embedded into who we are as humans and how we communicate and how we connect around stories and meaning. And the great thing is metaphors are not specific to any theory. And so we see some theories that like to lean towards it a lot, right? So you see it a little bit more in the humanistic theories. You see it a little bit more in Adlerian, where you do a lot of creativity. So there's some theories that tend to use it more than others, but it doesn't belong to any specific one. So it doesn't matter what theory you are, you can use metaphors, you can kind of embrace them about talking about the process of therapy in really a comfortable way. You know, instead of saying like, you know, there's a problem or an issue, using a metaphor sometimes can just be a really comfortable way of talking about something that's really hard for a client to talk about. There's a lot of functionality around metaphors, right? So it uncovers something that's hidden, right? So it uncovers some specific piece that you can kind of pull out and discuss and dive into a little bit deeper. But it also connects something that's very abstract, and that's where I think the big jewel is. Something that we're just talking about very abstract, it makes it very tangible. You can hold on to it. It becomes a little more real. It also gives new perspective. So for those of you out there that are cognitive people and love that cognitive restructuring and new perspective, the metaphors are a great thing to incorporate, and it inspires creativity. So there's a lot of different things that kind of come from using metaphors. I love the fact that we're not even just talking about it as a sense of some, you know, abstract out there kind of thing. It actually gives us the ability to feel what the client is sharing. So when we think about the idea of empathy in connecting to your client, a big piece of that is being able to see the perspective of your client, what it's like to be in their shoes, really developing that understanding. So metaphors give us the ability to do this in such a strong way. And so it's not just some, well, here's what you should try. This is actually, we see this over and over, that there are so many sensory components that give us such a sense of feeling what the client is sharing and feeling what's happening in their story. And I'm going to pass it to one of my presenters, I think. Yes?
Yes, the key points.
Okay.
Sure.
We're so polished, you guys.
That handoff was so much better than last time.
I know, I struggled with the handoff last time. I'm getting better. I'm getting better.
We're still working on our metaphor on how to hand off when we
Yeah.
do our presentation. If you guys can come up with one for us, it would be very helpful.
Yeah.
So we can make this flow better. So as Dr. Spencer talked about, with the use, metaphors have been going on for a long time. I mean, think about your daily conversations. You use metaphors in that. So key points with metaphors is with family you use it. It's not just with clients. More common metaphors help us understand and emphasize with our clients. I have a lot of clients that come up with their own metaphors, which I stated earlier, or I help come up with the metaphors with the information that they give us. As counselors, we need to listen for the metaphors, because I noticed in the chat box from Chuck that he's found that a lot of his clients are using metaphors in practice, because it does help clients to help understand what is going on in their life. I had a client that developed their own metaphor with moving the boxes, and we used that through their whole therapy session because they were very stressed and they couldn't figure out how to get out of the situation. And they decided that these boxes are blocking them. So each week she would come back to me and tell me that one box has moved, and sometimes the boxes have come back up in front of her. So that's how we developed our session. Metaphors are also very powerful and they can affect the session. You got to remember that metaphors can be flexible and it helps them understand better. 3 basic strategies to utilizing the metaphor for change is explicating what is implicit, reflective listening, modifying the metaphor. It might be too much for them, so maybe helping them bring it down so it doesn't overblock the session. And another one is creating and delivering therapeutic metaphors. The next thing about is using metaphors in group supervision. Many, as Dr. Spencer and Dr. Brown and I supervise, so I use metaphors when I'm supervising with students. So an example is using it in the mid-semester. I have them come up with a metaphor of beginning supervision and their sessions, and then in the middle of supervision, let's say it's 5 weeks in, how has their metaphor moved through supervision? Where do they see their metaphor going on? Think of, if you think of with your client, let's take Chuck for example, if he thinks of his clients that are using the metaphor, how does he guide them with this metaphor? How does he help them see the importance of the metaphor and moving through the session? There's some different activities that I use to enhance the supervision, is help the supervisee understand the process of becoming a counselor. And another one allows the supervisors and the supervisee to develop a shared language into conceptualizing the case. The ethical issues with metaphors. There's countertransference. So I have them develop metaphors of the code of ethics for, LPCs and LMFTs. It's teaching the supervisee to be familiar with the codes. I mean, you can't sit there and memorize the codes because you can always look at them, but developing a way of knowing what's important ethically and developing your own metaphor. The code can feel more reachable, not just a list of rules for them. I have students ask questions about the codes, talk about what it means to them and how they can put it into practice. This allows them to connect with the codes. The whole thing with the metaphor is how you can connect. What is the connection between you and your metaphor? I have students develop how they can incorporate these codes. If they get stuck with a client, how do they use the codes? How do they feel comfortable? And establishing, confidentiality, or if they have to break confidentiality, what does that mean for them? What does that mean for the therapeutic relationship? I promote healing and growth with the transformation of the codes. Metaphors have the ability to enrich the counselor and the client's understanding of the history and the relationship and the environmental supports. Counselors also have the liability and responsibility to provide the services that are ethically appropriate with the code of ethics. So I want them to embrace the codes of ethics. And I don't want them to feel like, oh, if I do this, this is what's going to happen. Well, what about the code of ethics makes you comfortable to know that you are doing the right thing with your client? Another thing to always remember is metaphor should not be pushed on the client. If you come up with the metaphor and they don't take to it, then, you can talk about it or just drop it. It's like coming up with goals. if you come up with the goal for the client, what is the possibility that that client is going to do that goal? Telling the client, okay, go exercise 5 days a week when the client can barely go 1 day a week. And then it's set for failure. So you want to make it a comfortable situation. So that's even with metaphors. And now I'm going to hand it over to Dr. Brown to talk about multicultural considerations.
Thank you very much. I appreciate that. And this kind of segues nicely from ethical issues. The multicultural consideration segues nicely from the ethical issues. To kind of keep in mind, metaphorically, we use, I should say, metaphorical language about every 20th word or so. So to say that we talk metaphorically is, an understatement. What we're really kind of considering here is the intentional metaphor. So when you're using metaphorical information in your common speak, I think it's important to be cognizant of if the person that you're speaking to is understanding what you're saying. To take this a little bit deeper, if you're developing a metaphor, you want to, and this goes without saying, be sensitive to the culture that you're sitting across from. Specifically, there are some questions that you can begin to consider. Do you understand the culture well enough to use the metaphor? It's really easy to kind of get caught up in a metaphor that you understand completely and almost like a leading question that you know the outcome. However, that does not mean that the receiver really understands the context of the metaphor that you're using. The other thing is, do you understand the individual's cultural experience well enough to use the metaphor? And this is what I mean by that. I've got a friend named Kyla, and Kyla's originally from Colombia. But she was largely raised in Boston in the United States. So when we go out to eat, there have been occasions where people will come up and they look as though that they may be from the Colombian region or what have you. They come up and they speak with her. She smiles, she nods. And when they walk away, she'll look over me. She says, Brown. She calls me by my last name. She says, Brown. I have no idea what they were talking about. What was that all about? I was like, why did you nod and smile the whole time? She's like, I didn't want to get into that with them. And I find that that's really common with what people will do, clients will do in session. If they don't understand what you're saying, they nod and they smile, and then they leave with the, what was that all about? And so it's really important to the culture that's sitting across from you, but also how that individual is experiencing and has experienced their culture. Some things to kind of keep in mind. There are some cultures that when you challenge them directly, for instance, like if you're challenging some automatic thoughts or what have you, if you're using REBT, CBT and whatnot, they can find it to be invalidating, almost as if you're talking down to them by correcting what they're saying, even if you have a lot of science behind you and you understand completely what you're doing. Also, if someone's from a collective society and you come up with a metaphor that really calls out the individual, this can be very dismissive to that person from that culture. Things to really kind of keep in mind, because the last thing we want to do is come across insensitive. And I'll also say, it's not that I don't have clients that grin and shake their head and leave my office sometimes, and they might be confused, because what we're doing is so cognitive in nature. Sometimes it takes them a while to kind of walk through. But I think there's a difference between leaving the client with more questions rather than leaving them in this ambiguous state where they feel invalidated. Really important stuff to consider. We're not experts in every culture. There are so many different cultures and subcultures around the world. I think it would be impossible to know them all. So I think that probably one of the take homes is to make sure that you're an ongoing student of different cultures, to make sure that you're aware and that you make yourself aware of the culture that's sitting in from the person that's sitting in front of you. I think that's probably a good way to kind of view this. Other things. For instance, with the Jewish culture, one of the things, and I love Dr. Spencer's book, and she's got another one coming out later this year. And one of the chapters has to do with a tattoo and a metaphor of a tattoo, and it's a really strong metaphor. However, with people who are from the Jewish culture and whatnot, and people who adhere to a strong Jewish tradition, they can't be buried in a Jewish cemetery if they have ink. And so, talking to them about, tattoos or whatever may not go over so well when they're not, plugged into tattoos. They're aware of them, but it's not something that they enjoy. And this kind of flows into potential roadblocks, where the metaphor may or may not work. Avoid cliches. The latest research shows that fresh metaphors are most powerful. When we're looking at developing metaphor, which we'll have an opportunity to do today in our time, things to kind of keep in mind is that it's really usually more powerful to integrate the client into the development of the metaphor. If you're using this for supervision, this is a great activity to use with your supervisees, is to have them develop a metaphor, potentially for a block that they're experiencing or a struggle that they're having with clients. Be aware of countertransference issues. There's nothing like going through session and dealing with para issues as you're experiencing grief or loss that's not been completely resolved, and you're working with a client that's also currently experiencing grief and loss, and you have this parallel processing phenomenon. Be cognizant of the impact of the metaphor on yourself, and be cognizant of the potential impact of the metaphor on the client. Also, theoretical underpinnings. If you're using these metaphors with supervisees and whatnot, you might be all about cognitive behavioral therapy, and then you have a supervisee that's humanistic or Gestalt or what have you, and so they pick up what you're putting down, but they don't love it, and it's hard for them to really kind of connect with, and it's not incredibly effective. Also, be aware that you can extend a metaphor too far to the point where it breaks. Don't break your metaphor. And what I mean by that specifically is that you may be in one of those situations where you're using a metaphor and you've used it a little bit too long to the point where you're starting to smile, or the person in front of you is kind of giving you that grin like you should have stopped about 2 minutes ago. This kind of renders the metaphor, I won't say powerless, but it takes away so much of the potency of the metaphor when you extend it too far out where it actually breaks. And I used a metaphor there to describe that. So it's something it's so fluid after you kind of begin to develop an ear for metaphors, how often you hear yourself using metaphorical language. So then we go into additional applications, and looking at a metaphor. If you developed a metaphor, if you develop a metaphor today, look at different ways in which you can use that. Is this something I can use with a client? Can I also use it with my supervisees? Is this something that I can use with loved ones who might be having a hard time understanding or grasping what I'm doing or trying to relay? Look at the different ways that it can be adjusted. So, for instance, going back to theoretical orientation, if you're overseeing a group that's largely cognitive therapist or whatnot, but then you may have an opportunity to meet with an individual who's humanistic or existential and what have you. How might you adjust that metaphor to fit that person? Because in the end, we want to develop a metaphor that's going to be suited for the situation and the individual. So looking at the additional applications, really important and powerful. So with that being said, I'm going to turn it back over to Dr. Spencer, who's going to actually walk you through the development of a metaphor prior to our helping you to develop your own metaphor today.
So several of you are asking about examples, so let's go through one, because we've talked a lot about all the different levels and the deep components of using metaphors and things you need to consider. And we outline this because the reality is metaphors are best when you've thought through them ahead of time. It's just like when you're working with a client. You don't want to dive into working with a client and then run into challenges that you could have anticipated or really worked through, for example, ethical issues, right? So one of the things that we encourage is if you're going to use metaphors, especially to explain the therapeutic process, then these are different ways that you can do that. So I'm going to go through and explain one that I use a lot that I call the emotional surgeon. And this is a very large metaphor. Not every metaphor needs to be gigantic, but this one is quite big. And so it actually encompasses the entire therapeutic process to explain from start to finish. And I use this more in peer-to-peer. So if I'm trying to explain this to a supervisee or to another counselor, that if I'm listening to their discussion, I might say, oh, I'm hearing your case, but this is the piece that got left out, or this is the piece that we need to focus on more. So I'm going to use this as an explanation to you guys, but I also have used this with clients. I've just taken some pieces and explained it really concisely to them, not using the entire thing. So the emotional surgeon, I'm going to walk you through it here. The emotional surgeon. So I want you to imagine that a patient comes into a surgeon's office and says, there's something wrong with my arm. Technically, clients don't just come in and pull their sleeve up and here it is. You have to have some bedside manner first, right? They need to feel comfortable showing you what they're going to show you. And for many of our types of clients, when they come in, they might even feel really vulnerable to show someone something that's very broken. A lot of times I tell my students that you're the last choice. They don't just wake up and go, I think I'm going to go to counseling today. And it's actually really similar in physical pain as well. How many of you have had something happen, or like a rash or a scratch or something, and you've Googled it first, or you've asked a family member, or you've asked your mom, or you've asked your partner. You've tried to come up with solutions on your own already. That's super common, right? So that bedside manner, getting to know them, and then slowly moving the sleeve up to see, hey, there is a broken bone there. So yes, I drew this. If you can't tell what it is, one time I drew this and my class said, is that a chicken? I don't know what that is. So art is not in my future. I'm very aware of that. That's definitely some awareness I have going on. So, but this is a broken bone. So surgery is not really the first step. Sometimes when we think of therapy, we think immediately that we're going to go in and fix something, but it's not the first step. So what happens is we have to get deeper examination. When you see a broken bone, you don't immediately jump into, we're going to fix it. First, we got to figure out how broken it is, right? Are there fractures of the bone that have splintered away? Is that area, has it been broken so long that there's now infection? Has the infection gotten to the bloodstream and now impacted the rest of the body? So now it's not just the arm that's broken. Now the rest of the body feels sluggish because it's carrying around the infection. Now the rest of their life is impacted. Maybe they used to write with that arm and now they have to start writing with the other one, right? They have to make adjustments to deal with the pain. We need to know current level of functioning. We need to know, is this happened before? We need to get an assessment of where we are in order to take a step forward. So again, surgery, going right in and fixing it. For those of you who are like instant problem solvers, the second you sit with a client, surgery is not even the second step. So there's a lot that needs to be done before we dive in and start doing intervention. Let's say we finally get, after understanding where we are, what the break is there infection? Is there even, let's even add some extra in, the pieces that everybody loves to focus on, but is not really the true broken bone. Are there ways that they're now coping with the pain? Are they drinking? Are they using? Are they working out excessively? Are they eating too much? Have they decided they're going to sleep 16 hours a day, right? So these are sometimes things that we use to cope with pain, but they are not the focus of our treatment because they're not the broken bone. So once we get past the assessment and we understand kind of where we are and what the broken bone looks like, we select surgery very precisely. We don't just go in there without a plan. We reflect on it. a lot of times there's consultation with other surgeons or there's consultation with other teams to get ready for the surgery. It's very purposeful, just like our work with clients and our selection of our treatment is purposeful. It's not thrown together. We select very specific tools to take care of a broken bone. And we select very specific tools to take care of a client that's having some brokenness in their life as well. So we take our time, we move towards having a surgery, but it is not the last step. It's not the first step, it's not the last step. After surgery, we have to start planning healing, rehab, future planning. Think of this for a second. If you have a broken bone, that bone is susceptible to being broken again. So there has to be some sense of allowing that to heal and then allowing some understanding of planning to keep that bone strong again. So there's a lot of steps involved after. So we don't jump in with a client. Here's what we're going to do. You need to do this, and I'll see you. It reminds me of that Bob Newhart there's a YouTube clip of it where he says, "Stop it. I can fix everything in 5 minutes. Stop it." It's not that simple. If it was, I don't think our clients would come to us. So we are working with the client, going through the process of getting to know them, getting to know what the break is, and then going that step further of now helping to keep them healthy and to not needing us in the future to coming back. So let's walk through some of the other pieces of that. The other piece is, if I really want to pull out the key components of this metaphor, it's that you have to have relationship, you have to have assessment, purposeful intervention, right? Planned purposeful intervention, and then going through a termination process. We don't just stop with our clients. And I will use especially that component with clients that are starting to get better. And I explain that we have to go through the healing. And we might not see each other as much. We might start pulling it back, but we're going to keep going through the termination process so they don't have to come back because of a break. If I use this in supervision with a group, some things that I might ask is how you tell the difference between a broken bone and how you tell the difference between infection. So the side effects of brokenness. Ethical issues. If you have brokenness similar to your clients, then countertransference may happen, right? So let's say that a client, experienced a significant sexual assault, and it has caused such a disruption, and they're working through the situation, and you have gone through something similar. That countertransference, because you've not worked through it, may be an issue there. So we would be really keeping our eyes on an ethical issue of countertransference. The other piece is if you have countertransference around seeing people in pain. That is majority of who we see. People that have experienced loss or pain or really going through something incredibly challenging at the time. So if that triggers you in any way and you haven't worked through that, then that would be something we would consider as an ethical issue. Multicultural considerations. When we talk about the speed of how quickly a therapist intervenes, in some cultures, they want us to intervene much quicker. So we would have, well, I'm frozen. Do you guys see me? Or did that just, oh, we're still good. I see everything. Okay, got worried there. So how quickly we're getting to the intervention part, or even the directiveness component, would be a consideration here. Potential roadblocks. I learned, unfortunately, that I didn't think through potential roadblocks when I first used this metaphor. And I had a person that was highly sensitive to medical visualization. So when I talked about a broken bone, and I had worked in an emergency room for years working with suicide and homicide and really acute mental health cases. So I talked about how, if you've ever seen a broken bone, it looks like this, an infection, it smells and all this, and they started to get nauseous. there's a potential roadblock. I completely didn't even consider that that would have been an issue. So that was really challenging for me and very insightful. Like then on, I had to think about, oh, I need to be careful in how descriptive I get when I talk about this metaphor, because I don't want my client or even a supervisee to get nauseous when I'm talking about it. The additional application for this metaphor, it can be extended into the area of dual relationships. So how different it would be if your best friend decided to do surgery on you, and how that would completely change your actual perception of your friend, but also their perception of therapy, and then your relationship just in general would completely change. So this metaphor can actually be extended out a little bit more. Okay, so I see several questions. I'm going to pause for just a second. How do you adjust metaphors to be culturally relevant? So one thing that I'll say, especially when we talk about using metaphors, is the fact that you have to consider that when I use metaphors, because I come from a humanistic perspective, I don't use them to tell them about their life. I use them to tell about the therapeutic process. So if you think of more of like psychoeducation, this metaphor explains what they can expect from the process. We're not going to, on this first session, just going to jump in there and it's going to be resolved and I'll never see you again. It's a process. So this kind of helps them to understand that. I'm going to keep responding to questions in the chat, and then Dr. Brown and Dr. Weiss are going to walk you through.
I've been trying to respond to some in the chat. We have a few questions and answers. One of the questions that came up was regarding meaning related to metaphors. What if someone hasn't broken a bone or hasn't experienced or understood the basics of the metaphor? What do you do with that situation?
I think in general, even if they haven't broken like I've never broken a bone. Like I guess I should knock on wood. I don't even know if my desk is real wood, but I haven't broken a bone, but I've seen it, right? I've been close enough to it where I can connect to it. That's the thing about, the human existence. You don't have to experience every single thing that someone else has experienced, but you can connect to a concept, you can connect to a feeling, you can connect to an experience that you've seen or witnessed or heard about. I don't think any of us has never heard the concept of breaking a bone. So there would be times that you might not have experienced it specifically, but most people can really connect to the idea itself because they've seen someone do it or they've heard of a friend doing it.
Okay, we have one more question, kind of a compound question here. Do you use the same metaphors for multiple patients, or do we need to consider the cultural barriers? How do we formulate a metaphor that may help the client to understand us easily?
Well, some of that is we're about to walk through forming
Yes.
your own metaphor, so that's perfect. But yeah, I do use, I've used this metaphor and I've developed it over years, and it keeps developing it. So when I wrote this book, it's laid out the same way I have now. But maybe a year after I wrote the book, I had someone say, "You worked in crisis when someone was suicidal. How would the metaphor apply to that?" And I never even considered that. And then it hit me, oh my goodness, that would be you being on a table and going through surgery, but then all of a sudden your heart stops. So then the idea of surgery kind of comes off the table. The risk assessment of we need to make sure your heart doesn't stop becomes the primary focus, keeping you safe. So interestingly, that you can use the same metaphor that you develop, or someone else's metaphor, over and over, but you can develop it and even expand it as you grow in your skill set. So let's create our own. Go ahead.
I use one a lot is when I'm trying to show them, I use getting on the train or being left at the tracks when I'm trying to help them look at change, and that everyone else around them in the system will be able to either change with them as they hop on the train, or if not, they stay on the tracks. So if change is important to you, you keep heading on the train while everyone else stays. And then I've adapted that. to show. So that's one metaphor that I use throughout sessions.
It's also dependent on your client base. As someone who works with trauma, I see a lot of vets and people who are currently in the military. And a common expression that that we use there when we're talking about change and getting on board with change is you get on the boat or get shot on the shore. And now that's kind of a graphic and can be a violent kind of metaphor that I wouldn't use with some clients, but with my military personnel, they totally connect with that.
So let's walk through the keepsake. You want to open it up? Or you want me to open up?
Sure. You know, we're starting. This is for a development of your own metaphor, one that you can take with you. We hope that through the process today that you've kind of written down some of these key components, so that you can develop a metaphor either for yourself, for your client, for supervision. I've seen some of you kind of pop up that are taking classes that you can use these for in whatever way that you'd like to use this. We start with, of course, the content area. So as you kind of begin and are developing the content area, what's your focus? Who's your audience? Who's the individual this is for? What's the population? What's the issue that you're trying to work around? It's one of those situations, and to use another metaphor, if I can't reach a client through the front door, I go to the back door. And if I can't get through the back door, I go through the window. And if I can't go through the window, I go through the chimney. And I will continue to try to look for ways in order for them to connect with the information that's really pertinent for them.
Yeah. So let's make this interactive. You guys, if you're seeing clients, think about a client that you're working with and an issue that you're working through with them to develop your own metaphor today. If you're not seeing clients, you're welcome to think of maybe even something you're seeing in your world or with others, or, I mean, we're all going through a pandemic. Man, we could really come up with metaphors for COVID. Right now it feels like a cave, but very dark, alone cave. But so think about something and feel free to type in the chat box to just start. This is the brainstorming process. This is where this begins, is thinking about what it means and how you could develop it. So content area, feel free to type it in and start your brainstorming.
Dr. Spencer?
Yes.
Did you see the question that came in?
Yeah, I think I would need a little bit more, Hamid, about some clarification around. So how do you work with clients? Explain something with a metaphor. How do you decipher or take clues from that? Give me a little bit more so I can understand how to answer that. I'm gonna start on an answer, and then if I'm not in the same ballpark as you, let me know. But usually when you're working with clients, so if it's about their situation, so again, this is right now I'm going to say a very theory specific perspective that as Gestalt therapist, I don't take my metaphor to explain it to them. I might just use a metaphor about explaining the therapeutic process, or I might use a metaphor to explain something a little more third party. Like if we're talking about depression, I won't say this is the way depression is for you, but I'll say for many people, this is the way depression they experience, right? And then I might use a metaphor. But a lot of times I listen for them to talk about any metaphorical language, and then I kind of pull that out. So let me give you an example. A client says, my life is just like a roller coaster right now. So it might be, okay, take me on a ride for that roller coaster. When did we get on? Right? What are the dips? What are the highs? When are we flipping upside down, right? Is let's go into that feeling, right? Is it like your feeling in your stomach is sinking, or is it excitement? Like kind of diving into some of that.
I just added a metaphor that I recently, within this last few days, posted on my blog about someone brought up the use of, people are using the word trapped and metaphors to dealing with trapped to talk about the isolation, which is what I wrote about. I talked about a bear coming out of hibernation, and what do you do? What does a bear do when the bear comes out of hibernation? So I posted that along with the link there to, if you wanted to kind of see the extended part of that that metaphor. But kind of circling back around, so many really powerful. It's been interesting because within the hibernation and the isolation, you've seen an incredible creativity come out of this time. The memes alone have been
Yes.
stellar. Talking about little like verbal and pictorial metaphors, because there are different types of metaphors. There are physical metaphors and pictorial metaphors, and of course, spoken and written metaphors. And so to see these little memes that are metaphorical and whatnot, and just the creativity that are coming out of it, it's pretty interesting.
Yeah, I have to agree with that. I think that this is probably the most creative I've seen people come up with the funniest things I've ever seen.
The memes are quite good, and you can come up with a lot of metaphors. Like there was one the other day about something about meanness, and I came up with, meanness. Someone started with meanness about bone marrow, and I said, no, meanness all the way through the body bones, to share the meanness.
I love it.
Why leave it to just the marrow?
Yeah. Oh, I love it. So I saw someone say the light metaphor, and I think to me, that's a really good one because it's so easy for people to connect to. And then also a gardening one. Actually in our second volume of the book that's coming out, there's an entire metaphor on how our process is with clients in a garden. So like the garden is their life, and we may only be in there for a very small time, right, to help pull weeds out. We may only be planting seeds. Sometimes you don't get to go from start to finish in a client's life. Sometimes they come in, they get what they need, and they roll out, right? So you might not see the flowers bloom at the end. I mean, sometimes we're really lucky and we do. But sometimes they get enough to be functioning and then they head out. So I love that you guys are really starting to kind of see your own.
Someone brought up, the using gardening, of course, earlier, kind of circling back around, and living in an agricultural area. That would be really powerful because a lot of people really understand gardening and what have you in my area. So that could be a really powerful thing.
Yeah. And interestingly, and there's that multicultural consideration. Think about where the person lives. If they live in a place, I might not talk about water skiing as a metaphor in Canada because that's not really, I might talk about snow skiing instead, right? Being really specific about their exposure and what really resonates with them.
In trauma, I normally talk about the importance of warming up the amygdala in the brain in order to rewire it. Without warming up the amygdala, you don't get proper rewiring when treating anxiety or trauma. And the metaphor I use is what we have down here in the Southeast called sweet tea. And I've given this talk, pretty much all over the world at this point. And there's a lot of cultures that don't really get a sweet tea or why you would even put sugar in tea. The thing about tea, in order to get it sweet, is you have to warm it up before you put the sugar in, or it won't melt together. If you put the sugar in after the tea is cold, it just drops to the bottom. It's a very depressing experience. So you have to warm the tea up. You've got to heat it up in order to get the sugar to kind of melt within the tea. But that's one of those things that from a cultural standpoint, in the area that I live, it really kind of goes over and people kind of get it. But going over to Europe or Greece or up north or what have you, and people are like, why would you put sugar in tea? It doesn't make sense to them.
All right. Well, so we've shared metaphors. I'm going to stop sharing here. Here we go. We've shared metaphors. We've talked about different components that you need to walk through and consider when you're developing them. Yes, it is a very American metaphor. I love that. There's those cultural considerations, right? They're One thing, again, that I'll kind of stress here is that if you're going to use metaphors, try to think through them before you walk a client through them, so that it gives you a chance to go through some of these components and gives you a chance to really think, what is something that would be a roadblock? What is something that would be a consideration that I really need to be aware of? So it gives you a little bit more time to process it. We'll take maybe a couple more questions and then we'll close out.
There's one that says, so can we develop a metaphor for an individual client if we think it will work for them?
Absolutely. You can throw it out there, see if it fits, right? And you might ask, hey, does this fit? And then have them pull it out, right? Have them develop it. Tell me how it fits. Can you speak to powerful metaphors that demonstrate self-growth to a client who may be struggling to see how counseling has benefited them? Oh, that's a good one. You guys want to take that?
Where is that?
Heather posted it. Can you see it? So self-growth, and there's so many, like even in the chat box, we talked about the garden metaphor and the idea that, so if you think about like even just gardening, right? The ground isn't always ready for a seed, right? People aren't always ready to grow. It actually takes work to grow. Have you guys ever heard the story of a hermit? Like, I think they're called like hermit crabs or something, but they're this kind of crab that lives at the bottom of a sea.
Hermit crab.
I don't know what it's called. It's some kind of crab thing.
Hermit the crab. I think you were talking about Kermit the Frog. And
no, not with a K, a H. They will grow so big that if they're in their shell, they'll actually like be like squished and they can't grow any further. They have to leave their shell to go look for another one. But if they leave their shell to look for another one, they're completely vulnerable to being eaten by a predator. Like they're exposed, right? But they will not leave and go to a bigger shell until they become so uncomfortable that they truly cannot stay in the shell anymore. And that's a lot how growth is. We don't get pushed to grow until we become so uncomfortable in what our situation is that we have to be vulnerable or face a really hard challenge in order sometimes to grow into something bigger and better. And so, if you think about, if you hear stories like that, hold on to them. They're great to share with clients for self-growth.
Someone also, I just saw it, that was good. Catherine wrote about with the garden was setting boundaries, which can tend to your own garden. So that's another way to show self-growth, because we all have difficulty setting our boundaries, and, stay in your own garden, like plant your own flowers, don't come over to mine and help me with that. So that's a good way also to look at it.
Mm-hmm.
There have been several questions about metaphors dealing with loss and even broken relationships.
Oh, yeah. Yeah.
The one thing that I would say about using metaphors with grief and loss is to be super sensitive, with your metaphor, because people receive that, can receive that different, of course, metaphors different ways. So and they're still incredibly powerful, and I recommend them and I encourage them. It helps people because sometimes their insights can be somewhat restricted because of the grief process. So metaphors is a way to kind of work around that piece.
Mm-hmm. And I saw a question come through about, seeing other metaphors or hearing other metaphors helps to inspire your own creativity. That's actually the reason why we wrote this book. This book was, my writing partner, Dr. Dean, and I were going through and talking about how we use metaphors all the time to explain things. And so we said, we're going to come up with some ideas. And it was just him and I. And then it was, if you and I use metaphors, I bet tons of people use metaphors in therapy. And so then it ended up being, well, let's ask other people. We had 33 different professionals across the world respond. and say, oh, I use them all the time. We had so many that we had to put 30, we actually have 33 in the first one. I think we have 40 in the second volume that comes out this year, because so many people are like, yes, I do this all the time, and they wanted to share their metaphors. So that's actually the reason why we wrote the book in the first place. So if that inspires you or helps you, feel free to pick up a copy. It's just amazing to hear all the different ideas. Like, we were blown away at how creative people are. People are amazingly creative, especially in our field. All right, well, I think that's our time. So thank you guys so much for chatting today. Really enjoyed all the questions and the ideas. Appreciate you guys coming and being a part of this. This is, again, a brand new webinar series. We're just kind of trying. But we also, I'll go ahead and put a plug in for next week. We have Dr. Mark Young. So if you've been in the skills class, if you've been in the practicum class, that book, the Young textbook, is our presenter for next week. He's amazing. So I really encourage you guys to come back and hear him and spread the news, because I feel a little bit like a groupie because I'm super excited that he's coming. But great person to listen and just kind of gain from. So feel free to come back, and I will follow up to make sure that Student Services sends out the email with all the resources from last week, and we post our recordings. Otherwise, you guys have an amazing day.
Thank you, everybody.
Bye, guys.
Bye.